Hello. Thank you so much for taking the time out of your schedule to further educate yourself on the important decisions ahead. My name is Sean McNair, and I will be your guide walking you through the Medicare space. I know that many who watch this presentation will be coming from different places in their Medicare journey. Perhaps you're only beginning your research, or perhaps you approach this information with the perspective that you are tired of all the nonstop bombardment of Medicare information, and you don't want to hear one more thing about Medicare. I get it. It is very easy to simply assume we know everything necessary, or at least know enough to make the best long-term decision regarding our healthcare. But I would challenge you to consider, what is your standard for knowing you are making the best decision for you? Many individuals rely on the advice of well-intentioned friends or family. Some people go with what someone else has chosen simply because they must have done research, so why bother going through it again for yourself? Many people obviously put their trust in professional insurance agents for their senior health care. These agents usually understand the market and make their best recommendations according to your personal needs at the moment. Some of these brokers and advisors may even be Christians and truly have your best interest in mind. I am not here to take anything away from these resources or research you've already done, as I believe more information is better than less. But my approach will be to help you have complete understanding. Agents and brokers, regardless of their intentions, will only be fully educated on 2/3 of your available options. For my approach, I will help you build a framework through which you can judge for yourself what the best healthcare options are for you. In order to do this, I will employ the following rules. Number 1, complete transparency. We all have biases when it comes to our healthcare, and that's normal. It's important for you to identify those biases as the priorities you have for your healthcare, and they may be different from my priorities. As such, we may look at the exact same information and come to different outcomes, and that is totally okay. Think of it like this. If I took you to a dealership right now, and on one side they sold motorcycles, and on the other side they sold SUVs, and you had to choose a new vehicle today that you would likely drive for the rest of your life, already, without me saying anything else, you already know what side you would go to. You wouldn't care what my preferences are, or what your friends are driving, or even what has the newest features. That's because you know what experience you want when it comes to driving, and what kind of driver you are. The difference between these two options is so large, the decision would be obvious to you. My belief is if you fully understand your healthcare choices from a long-term perspective, you won't need or want an agent to tell you what way to go, because you'll already know what kind of healthcare user you are. Number 2, in my opinion, after speaking with thousands of seniors and hearing countless ads, I've seen the senior market is really full of deceit. Not so much in what is being said, but in what is being shared with the customer. Rather, what's not being shared with the customer. I want to give you the full picture and not simply cherry-pick details to push you in any one direction. You deserve the same care and understanding that I would want from my own parents. Number 3, I will not be comparing market brands against each other, such as Blue Cross versus Humana. Rather, I will be helping you understand your options from a product perspective. All of the options out there work. However, it's important to understand the differences in how they work. Imagine we were at that car dealership, and I was explaining the differences between a motorcycle and an SUV. There would be fundamental comparisons between those two types of vehicles, regardless of the brand selling them. For example, motorcycles have 2 wheels and no doors, and SUVs have 4 wheels and 4 doors. Before considering a brand, it's important to know that these different vehicle types will deliver an extremely different outcome or experience, and brand may end up not really being that important or relevant at all. In light of this, it's important to be thinking, what do you want your healthcare experience to be like for the next 20 to 40 years or so? That could be the very decision you're making now. To set some context for our walkthrough, I've had the privilege to work with Christian Care Ministry for over 19 years now. During that period, I graduated Bible college, got married, and started my family. I spent about 16 years helping people understand the Medi-Share Complete Primary Healthcare Program. You would be hard-pressed to find any employees who have worked with Medi-Share longer or who have been Medi-Share members for longer than I have. The reason I mention this is to show that I know that product from a personal perspective. and have had many experiences using it as well. I am aware that if you are a Medi-Share member, it is very common and understandable that many seniors would assume that anything we offer in the senior space is simply a continuation of that same product. I cannot express more unequivocally the two programs are distinct and separate in terms of guidelines, eligibility, and experience. They have no relation except being offered by the same parent ministry, recognized for being the most trusted name in healthcare sharing, with roughly a 31-year track record, a flawless payment history, and over $7 billion in needs met. If you are a Medi-Share Complete member and have specific questions drawing from your primary healthcare experience, please write those down so we can address them at our scheduled follow-up appointment. The content in this overview will have nothing to do with the Medi-Share Complete program, our primary healthcare program. In regards to the choices in front of you, the fundamental flaw most seniors are making is that they are evaluating their options from the same short-term perspective they have each year prior, with the mindset that I need to find the best healthcare program for myself for the upcoming year, and then during next year's open enrollment, I can probably tweak or change my plans according to my needs at that time. I'm here to tell you, this assumption is not necessarily true, and is more often than not completely wrong. Consider this. Don't insurance companies always want as much business as they can get? Think about when you turned 64. How much were you inundated with mailers, emails, brochures, calls, and ads of all types, trying to get your attention and convince you to sign up for their program? Why do you think that is? The reality is, insurance companies know what they usually won't tell you. Statistically speaking, the healthcare pieces you choose at age 65, you will be on for life. The way they see it, if they don't secure your business now, they likely never will. If you were to ask an insurance agent, hey, can I switch my supplement program during next year's open enrollment? The answer would be yes. However, you would likely not have any reason to ask the next and more important question, which is, will there be a consequence if I switch? The answer to that question is also, in most cases, yes. You will come to find out that when switching into a Medigap from an Advantage or other Medigap, unless you are in a unique window of time referred to as guaranteed issued rights, or live in one of the specific states that have laws protecting consumers, insurance companies will be allowed to apply any or multiple of the following three consequences. They can deny you outright, limit payment for prior conditions for up to 6 months, and they most certainly will underwrite you and charge you according to your medical risk at that time. This is what the future holds for those who are 66, 70, 75, and so on. Now consider, when do people usually want to switch healthcare programs? Either after they've had a bad experience using one for medical needs, or have reached a point at which it's no longer comfortably affordable on their fixed income. Neither of these issues will likely be able to be improved and lead someone to find that they're stuck with no alternatives. Since insurance companies see it as their last opportunity to gain you as a customer for the rest of your life, this also plays into how they structure what they offer you in terms of initial pricing and sometimes even features. They only need to be attractive to the 65-year-old market, essentially baiting the hook, if you will. Once you're 66 and beyond, they can do whatever they want because you're most likely not going to be leaving. This is the whole reason I have created this roadmap with the input of many insurance agents and seniors who have shared with me the things they wish they knew when they were in your position. My hope is that you can benefit from the wisdom gained from those who have gone before you. Understanding your healthcare options matters more now than any other time in your life. Please be thinking about what you want out of your healthcare experience, not just for age 65, but what you could need at age 70, 75, 80, and beyond. As we begin this roadmap, I am representing the healthcare market effective in 2025. Depending on when you are viewing this, please note that, in general, the main things that change from year to year will be the numbers. Anything regarding monthly prices or deductibles and out-of-pockets can change from year to year, while how the programs work and what they do will remain mostly consistent year after year. As we go through this, it's most helpful to have the emailed PDF version of the notes pulled up on your screen or printed out. You can write questions as we go or pause the video after each section to consider what further details you would need to help you feel confident in your decision. This is not something to do with distractions in the room, so if at all possible, take the next bit of time and solely dedicate it to understanding this information. If you do, I promise this will be the most comprehensive and valuable Medicare resource you will ever review. Let's begin. Up until this point in your life, your healthcare has been handled by one single company, whether it be Blue Cross, Aetna, or some other company. That one program was responsible for doctor visits, testing, prescription, and hospitalization. Now, when you turn 65, your healthcare gets broken up into 4 different pieces. I describe what we're going to be putting together as the healthcare puzzle. Everyone will have the same first 2 pieces, and then what we add on top of that foundation will vary. So to start with corner number 1 and 2, that's going to be Medicare A and B. Ask yourself, have you already signed up for Medicare A and B? If not, that is the most important thing you could be doing. As long as you're within your initial open enrollment period, which is 3 months prior to the month you turn 65, all the way through 3 months after your birthday month, you can sign up for A and B. You do not want to put this off. Being a government agency, it can run a little bit slower with Social Security Administration, taking anywhere from 3 to 6 weeks on average to get out your cards. This is the foundation of everything that you're building. It doesn't require any decisions whatsoever, so I have provided a link in your email to enable you to go ahead and sign up for both Medicare A and B. Let's talk about these first 2 pieces of our healthcare puzzle. First of all, corner number 1, Medicare A. It is designed to pay for your hospitalization. It has no monthly cost associated with it, and at the time of this recording, it has a deductible of $1,676 per benefit period. You don't usually have to worry about that deductible if you make sure to put in place all 4 corners we will discuss. This is because any of the supplement options that you might get are usually going to handle that for you anyway. So I don't want you to really put any mental energy towards that Part A deductible. Corner number 2 is Medicare Part B, and that is going to pay for 80% of our doctor visits and labs. There is usually a monthly cost associated with that. I provide a chart to give you an idea of how much you could expect to pay for your Part B this year. The cost will be based on income from 2 years ago. Then 2 years from now, they'll be looking back to this year's income level to determine what Part B is going to cost you then. So be aware the expense of Part B can fluctuate from year to year based on your taxable income. Now, Part B, it also has a deductible of $257 as of 2025. I would say that Part B deductible is more important to keep in mind simply because it will likely affect you in the future, regardless of what supplements you choose. We will get back to that, but the big takeaway here is that Medicare A handles hospitalization and Medicare B handles 80% of doctor visits and labs. Let's move on to corner number 3. On top of these first 2 pieces, which make up the foundation of our healthcare puzzle, we now want to add on a drug plan. What are we doing for medication costs? With Medi-Share having so many healthy members, it's not uncommon for us to talk with people who turn 65 and are not currently taking any medications, or taking such minimal medications that their perspective is, why even bother getting a drug plan when I'm really not going to benefit from it? I totally get that. And yet my recommendation here is twofold. There are 2 main takeaways for Part D. Number 1 is that it is recommended to at least get yourself some level of a Medicare Part D drug program, because if you don't sign up for it now, during your initial open enrollment window, you will end up accruing a 1% penalty for every single month that you go without it. This actually affected one of my colleagues here at the ministry. He turned 65 and was in stellar health. No one informed him of this requirement, so logically, he waited 6 to 7 years to sign up for a Part D. When he finally did start getting medications and signed up for a Part D drug plan, they counted the number of months he had been without and increased his monthly premium by that percent. He will now have that added penalty for the rest of his life. We just don't want that to happen to you. At the end of the day, it's your choice, but you should be aware of this consequence if you make that choice. The other thing that's really important to take away here is you don't need to overbuy your Part D for drug benefits. Here's what I mean by that. I talked with an individual whose insurance agent had signed him up for a Part D drug program at $84 a month, and he wasn't on any medication. There was literally no reason for him to be on a program that expensive. Part D is something that doesn't bear the previous consequences for switching we've mentioned a few minutes ago. You can upgrade and change your Part D from year to year as your needs change without limitation. So to recap, the basic takeaways with getting a Part D drug program is number 1, get one, and number 2, Sign up for the minimal cost program that meets your current needs and risk tolerance, and know that during future open enrollment windows, you will be able to tweak or improve your Part D. Most of your Part D drug plans this year start around $4 to $7 a month in most markets. I have provided a link to Medicare's website where you can search through and compare all of your Part D options. You're going to plug in your zip code, answer a few questions as to whether or not you receive government assistance. They may ask you if you also want to look up Medigap or Advantage options. They're always trying to sell you something there. You just want to answer the questions to only show your Part D options. You will also be given the chance to put in any prescriptions you're currently taking so you can get a sense of the savings each drug program will offer for your specific medications. When you see your search results, you will be able to click on a blue button that says See Plan Details. Really, the only two areas where you're comparing these programs to each other is in monthly cost and how they're going to handle the 5 tiers of medication types. Those 5 tiers are going to be Tier 1, Preferred Generics, Tier 2, Generic, Tier 3, Preferred Name Brand, Tier 4, Non-Preferred Name Brand, and Tier 5, Specialty Medications. These are the areas that you're going to be evaluating, and like I said before, focus on getting the least expensive one that currently meets your needs, keeping in mind that you can change in any future years without consequences, like not picking up on prior conditions, higher pricing for medical history, or anything like that. You simply don't have to worry about that stuff with Medicare Part D plans. Now, let's move on to the most important section and where we'll spend the bulk of our time, corner number 4. Now, in corner number 4, the question we are answering is, how do we want to take care of the other 20% that is left over by Medicare A and B? We know Medicare A is paying for hospitalization with a sizable deductible, and Medicare B is paying for 80% of doctor visits and labs. So who is going to be responsible for the leftover expenses? This is the corner where everyone is competing for your business. There are 2 very different types of programs or healthcare vehicles we can choose in this corner, and they are as different as a motorcycle would be from an SUV. The one option is going to be called Medicare Advantage, otherwise called Medicare Part C. The other vehicle would be called Medigap, otherwise known as a supplement to original Medicare. Fundamentally, there is one key difference between these 2 options: who is in charge of your healthcare. With Medicare Advantage, an insurance company is in control of your healthcare experience. With Medigap, Medicare is in control of your healthcare experience. All of the pros and cons we're about to review are simply a consequence of who controls your healthcare. This would be a perfect time for me to reveal my personal bias. Like I told you at the beginning, I believe in complete transparency here. With that transparency, as someone who's been with Christian Care Ministry for over 19 years, one might assume that if my employer offered a senior program, that I would by default be choosing that for myself when I reach the appropriate age. Before preparing to join this team, where we are dedicated to the Medicare conversation, I can tell you fully that I expected that I would have gone with a traditional insurance Medigap Plan G program. When it comes to healthcare, I will be a Plan G person. That is the right kind of healthcare vehicle for my personal goals and priorities. I'm not a brand loyalist though, and I don't think it benefits anyone to be a brand loyalist or simply to choose a healthcare program based on the name associated with it. At the end of the day, I think your healthcare choice should be based on matching what the product actually does for you and what you're wanting to get out of your healthcare with the right company. So based on my priorities, which haven't changed to this day, that was where I had aligned myself. You may find yourself in a similar position in this very moment. Maybe you've even already signed up for a Medigap or Advantage. Again, that was quite a while ago, and understanding more about the healthcare space now, I do see things quite differently. The reality is, for both you and I, we don't know what we don't know. So my preparation to provide insight for you has resulted in a valuable education for myself as well. Now, having revealed my personal favorite, the very first of these options we're going to talk about is going to be an Advantage plan. While an Advantage plan, otherwise known as Medicare Part C, is not what I have chosen for myself, that doesn't mean it doesn't work. And it doesn't mean that there aren't millions of people on Advantage plans who absolutely love their program. What I've learned is that our happiness with our choices are based on expectations. So as long as someone has accurate expectations for the healthcare program that they chose, and that program lives up to those expectations, then that person should be very happy with their decision. That's going to mean that you may be surrounded with friends and family who are on Advantage plans that absolutely love them and they work phenomenal for them. And you're going to have friends and family who are on the opposite types of programs, on Medigap Supplements, and they love those and find that they work phenomenally for their needs. Likewise, you might find people who don't like one or the other of these programs at all. This always reminds me of a story with my dad that, more than most, really sums up what I've seen from human nature over my time in healthcare. One day we were having a conversation and he was absolutely livid. The air conditioner had gone out, and in spite of his pleas, the homeowner's insurance company refused to pay for the repairs. Knowing how this tends to work, I asked my father a very simple and seemingly obvious question. I asked him if this was something covered by his homeowner's insurance policy. I have found the perspective behind his answer to be representative of what I've seen from many of the people who have any complaints about insurance. His answer was, "Well, I don't know, but for how much you pay for it, it should." I can certainly empathize with how frustrating his situation was, but being outside of the emotion of the moment, anyone can admit that that is simply not how anything in the world works. It really just comes down to expectations and the fulfillment of those hopefully accurate expectations. That's why this roadmap is about helping you align yourself with whichever product best suits your needs, desires, and goals. So let's jump into, first and foremost, the Advantage plans. Now, since I've already revealed that I'm not personally a fan of Advantage plans, and I'm not going to be choosing one for myself, I think it's fair to say that nearly everything being offered in the market works. Whether it be Advantage or Medigap, I'm not disparaging any one of them. If a program didn't work, it would get shut down. So the true question is, how does it work and what differences matter to me? That being said, there's a whole lot to like about Advantage plans. And frankly, even knowing that I'm strongly leaning towards a Medigap Plan G for myself, when I looked at the Advantage plans, I was really taken aback and wondered, what am I missing? Because they sound great. I think once you hear the full picture of all the pros and cons of Advantage plans, you should likely have an immediate feeling of whether or not you're an Advantage plan type of person. So let's address Advantage plans. Frankly, they sound amazing. When you hear the commercials for them, you'll hear things like, "Hey, this program has no plan premiums." So they're coming out of the gate strong with that one. It doesn't actually cost you anything for most Advantage plans. So that sounds pretty amazing. Sometimes you might see celebrity spokespeople on TV saying things like, "You deserve everything you're entitled to." And then they start going into all the different features of how you may be able to get free trips to the doctor, no plan deductibles. Now, a side note there, you gotta be careful with that no plan deductibles thing, because that simply means there's nothing that they call a deductible. There are certainly numerous copays, coinsurances, and enormous maximum out-of-pockets. So that no deductibles line can be rather misleading, and it is certainly intended to be, even though it is accurate. The ads talk about all these free features that you get on top of the fact that you aren't paying a monthly fee. Some of them offer you free eye exams. Some of them offer very minimal dental coverage. Some of them offer assistance with free gym memberships, or even help with your vitamins and supplements for reduced costs or for free. So not only is the program free itself, but they give you all these extra freebies. When I came over to this team and started digging into these claims, my first question was, what am I missing? Why doesn't everybody join an Advantage plan? Even though I am already leaning towards a Medigap G plan, I was looking at these ads and saying, that looks pretty attractive. So I talked with a man who created our senior program here at the ministry. And he kind of shared with me his perspective. He said, "Sean, when someone buys a farm, they're not expecting the barn to be a cardboard cutout. And the idea is that sometimes what people think they're getting isn't what they're actually getting. So you always want to evaluate, what is it I'm trying to accomplish?" I think that's an important question for anybody who is making an important decision. What outcome am I actually trying to accomplish? Because it's really easy to get distracted with shiny objects along the way to making that decision. Think about any time in your past history, whenever you've purchased an insurance product, whether it be car insurance or renter's insurance, homeowners, life insurance, health insurance. Did you buy any of those products so you could get free groceries? Did you buy any of those products so you could get a free cell phone? No, of course not. You probably purchased those products for the utility they serve, which is financial protection in the event of some catastrophic need. Okay, so let's use that same criteria then, and to evaluate Advantage plans. If you are looking at an Advantage plan because you are wanting a program that gives you a free eye exam each year, then Advantage programs are probably a great solution for that goal. If your goal is to get free dental cleaning, then maybe it is a great program to help you accomplish that goal. Maybe you're looking for a free gym membership or help with vitamins maybe. Fundamentally speaking, budget is the number one concern, and you just need to keep your monthly costs as low as possible. Well, there's not getting much lower than free, so Advantage plans are a great way to go and can help you accomplish that goal as well. But if your goal is to protect yourself from large financial losses in the inevitable event of some future large medical bills, then Advantage plans may not be the best at accomplishing that goal. Let's look at that. I kind of explain this more on the con side, and when I say cons, it's really about what are the things that you have to be considering, because we're weighing these options out. So on one hand, we get all the pros Advantage can give us, and if we want those pros bad enough, then we're going to be willing to accept the cons on the other hand. That's how we're going to approach this as well. So why might Advantage plans not be a good fit if financial protection is your goal? Well, first and foremost, like we talked about before, Advantage plans are insurance-controlled products. So what happens when you sign up for an Advantage plan? You now have an insurance company blocking you from receiving any healthcare benefit from Medicare A that you've paid into your whole life, or from B that you continue to pay for a monthly basis. The federal government then subsidizes that insurance company to go ahead and take control of your entire healthcare. That's all four corners. Think of it like this. You are like the foster child, and the government is paying the insurance company roughly $1,000 every single month for you to be their problem. Agents will even typically make double or more in commissions for selling you these plans instead of traditional Medigap supplements. The Advantage plan is handling your healthcare just as your primary insurance company handled your healthcare prior to turning 65. Now, that does have some perks in that there is a single bill covering both your Part B and D. The drug program will be chosen for you. It's going to be included with your Advantage plan most of the time. You don't have A, B, and D all separated. Remember, you still usually have to pay for Medicare B even though you receive no benefit from it. And just like with Medi-Share Complete or any other primary healthcare program, when you have a medical need, you'll need to choose a provider in your plan's network. You must pay attention to who you do and do not have access to see. And keep in mind, people often tell me that their doctor is already in the network, which is great, but that doesn't mean that won't change. Provider choice within Advantage networks often change each year. Even more limiting is a lot of your Advantage plans are going to be HMO products, which means that you can only use the doctors available in that network. A minority of your Advantage plans are still going to be PPOs. PPO means you can use anyone you want in network or out of network, but if you go to someone out of network, you can expect significantly higher costs, sometimes near double for those services. This is just like you've experienced for the rest of your whole life. Consider for yourself, am I a person who travels now, or will I be traveling at all in my upcoming years? Am I going to go on vacation? Am I planning to visit friends and family outside of my local area? Am I ever going to go on a mission trip out of country? These are the kinds of questions you want to be asking yourself, because if so, you might find yourself either completely unprotected with no health care whatsoever, or having to do your homework ahead of time, or always living with the potential in the back of your mind that you could be taken to an emergency location or transferred to some facility outside of your control that would force you to pay much higher fees. Depending on your situation, you may not necessarily see this as a problem, but it's certainly something you need to be aware of and balance out as you consider the Advantage option. You also want to be aware that with a lot of Advantage programs, you have to go through pre-authorization for certain procedures, where the insurance company gets to tell you if the service you want is going to be eligible or not, or if they think that that's something that you actually need. And say you're with an HMO program, you have to assign yourself a primary care doctor who gets to be the gatekeeper through which you have to get a referral to go see a specialist. Now that's 2 doctor visits instead of 1. These are the things that you have to put up with. And then ultimately, I think the biggest issue with the Advantage programs is simply the out-of-pocket amount you're left to pay. According to the national average, ranges for 2023 you'd be looking at with Advantage plans would be anywhere from $4,835 when using in-network providers, all the way up to $8,659 on average for out-of-network services. Plans that are HMOs will give you only one out-of-pocket number, which may be lower because if you do receive non-emergency care outside of your network, you're often not protected at all. It's just a self-pay with no reimbursement. These are really high numbers and frankly, higher by far than your expense risk with supplement options. I find it appropriate to describe it like this. The Advantage plans are really only an advantage as long as you stay healthy. And in some cases, they may be only an advantage as long as you stay healthy. I did talk to a woman whose husband was on an Advantage plan for about 4 to 6 years, give or take, and he was doing really well off. He wasn't paying anything for his Advantage plan on a monthly basis. So all of his friends who had traditional supplements would have thought he was way ahead of them in terms of financial stewardship. Until one year, he came down with cancer, and his max out-of-pocket on his Advantage plan was about $6,700. So even though he had gone multiple years paying absolutely no premiums for his Advantage plan whatsoever, by the time he finally had this one unforeseen medical need, his out-of-pocket was so high that it literally erased all of the financial advantage he had gained during those previous years. His savings over choosing a Medigap were wiped out in one single year, and then the very next year, that $6,700 reset, and he was likely going to face another $6,700 out of pocket. So what you will typically hear when someone is selling you an Advantage plan is a combination of these phrases. Number 1, hey, you're healthy right now. Number 2, you're not going to need to use this program. Number 3, and it doesn't cost you anything, so you should probably just sign up for an Advantage plan. Phrases like this are used to encourage someone to choose Advantage plans because if the person recommending them knew right before you turned 65 that you were about to need a knee surgery or some other major procedure, it would be highly unlikely that any insurance agent or broker who cares about you is still going to recommend an Advantage plan. They would know you'd immediately be hit with one of the biggest downsides to choosing one, which is the crazy high out-of-pocket. That extremely large out-of-pocket may be okay for you if you have the money in the bank already, or it's not really a concern, or you're very confident that you're going to stay perfectly healthy for a long time to come. Given my line of work, I hear far too often statements like, I'm in great shape, and I'm not really planning to need medical services this year. Well, who do you know that has ever gone to an urgent care or hospital that was planning to be there that year? The reality is, we just never know when something's going to happen in us or to us. You must ask yourself, how much am I willing to gamble that as I get older, that I will not experience large medical bills? You might also ask, why is the government willing to pay so much every month, both to the agent and insurance company, for me to be on Advantage? The answer is, they see it as the less expensive option for them. If you choose an Advantage and something large happens to you, you will likely never be able to move back to original Medicare because the supplement companies can deny you or give you some consequences in at least 42 out of the 50 states. This is how many seniors eventually become trapped in these programs, and Medicare A and B will never have to pay another dime towards their medical bills. This has been the Advantage overview. Now we'll move on to Medigap. Medigap programs are also referred to as your traditional Medicare supplements. 50+% of the market choose these, while 45% of the market currently choose Advantage plans. With the Medigap options, it can initially feel overwhelming because some websites show so many different letters or variations of the Medigap programs. But I want to keep it simple for our walkthrough. There is a very important fundamental detail that will help you understand Medigap programs. That is, unlike Advantage plans, which can all be very different from each other and even change from year to year, Medigap plans are standardized healthcare. For example, imagine you had 5 electricity companies in your area and you switched to a new company. It would have no effect on how your electricity worked or how you turned on the TV. The only thing that would change from one company to the next is the cost. Likewise, a Blue Cross G in Florida, an Aetna G in Texas, and a Humana G in Alaska would all be completely identical products because they all bear the letter G. All Medigap plans of the same letter are the same in protection. The brand that sells it changes nothing but the price. I have provided a chart in your notes that show you several variations of your Medigap options. A couple takeaways from that. Number 1, Usually when people are selling Medigap, they're referring to either a G or an N. I'll explain the differences in a moment, but those are the two most popular. But with an N, everything basically will compare back to Medigap G. Plan G is the current king, if you will, of the Medigap supplements. That means it's the most comprehensive. They don't really sell Plan Fs for the most part anymore, so you can ignore that column in the chart. But ultimately, G is the one that gives you all the best features and perks Medigap currently has to offer. So if you're looking at any other letter besides a G, you can just expect it to basically be a G with something missing or not as comprehensive. That's the way to understand it. Now, like I said, the most common options are going to be a G or an N, and the main difference between a G or an N is going to be whether or not your supplement will take care of excess fees and charges. So I think it's a good time to address what are excess fees and charges. If you scroll down in your notes right below your chart in Roman numeral number 4, you're going to notice that I explained that there are 3 different provider types out in the market. There are providers number 3 that are opt-out providers who basically don't see Medicare patients at all. So you're going to not be using them anyways, unless you plan to just be a cash patient. So we'll ignore those. But then you have options 1 and 2, where you have participating providers and non-participating providers. So let's say, for example, you had a doctor that you were using currently, and when he charges for a doctor visit, it's going to be $250 per doctor visit. Well, let's say when you use Medicare at that office, Medicare gets billed first, and Medicare tells the doctor that he's allowed to charge only $100 for that visit. Then Medicare pays their 80% of that $100, and the other $20 is then billed to your supplement, and they handle that from there. If this is a participating provider, that is exactly how that scenario would play out. But let's say our doctor is a non-participating provider, someone who isn't bound to honor Medicare allowable rates. Well, in that case, let's say the initial bill was $250, Medicare gets billed first, and they tell the doctor they can charge up to $100 for this. And by the way, here's our 80% of that $100. Then they bill your supplement for what's left. But before they do that, the provider's office says, no, we actually think we're worth more than that. So we're going to bill up to the 15% above Medicare allowable rate that we're allowed to charge. In this case, that would mean that the total that's left over is $115 instead of just the $100 that Medicare had initially allowed. Medicare still pays the 80% of their allowable amount, so $80. But then you are left with the $20 left over from that, plus the $15 in excess fees and charges the provider added. If you have a Plan N, that 15% difference would be your responsibility. If you had a Plan G Medigap option, that would cover those excess fees and charges. You would not have to pay the other 15%. That's really the only difference you need to worry about. There is slightly a less monthly cost for N because it leaves you exposed for that extra 15%. This lower cost is why some choose the N over the G. Keep in mind that if we're dealing with a $100 service and the excess fees and charges are only $15, it's not really a big deal. But if we're dealing with a surgery that's $100,000 and the excess fees and charges are $15,000, well, then that's a much bigger deal. So that's really the decision you want to make is, if I'm choosing a Medigap supplement, am I willing to take that risk, or do I want something that will take care of those excess fees and charges? For the point of my overview, I want you to know that every time I refer to Medigap moving forward, I am referring to a Medigap Plan G, the most comprehensive Medigap supplement you can currently buy. When I initially considered what options I would choose if I were turning 65, that was initially what I was drawn to. And I'm going to actually walk you through my thought process because you may connect with the things that were important to me. There are certain priorities that I would have regarding my senior healthcare experience that the Medigap options provide for me. If you connect with that, it may be a good sign that you're also the kind of person who would do well with a Medigap rather than Advantage. If you don't connect with those same priorities, maybe there's other reasons, or maybe you're a person who connects more with an Advantage product. So let's go through those personal priorities that I was considering. First and foremost, when I was evaluating what I would want from my healthcare experience, having been with Medi-Share working in the healthcare market for over 19 years now, the very first thing that came to mind was that I just wanted my healthcare to be simple. I didn't want to have to worry about what providers I could or could not see, who was going to take my program or not take my program. I didn't want to have to think about it if I was traveling or going on vacation or out of town. Will there be providers that I could see? Will they be able to reject me or not? I didn't want to have to worry about these things. I just wanted my healthcare to be simple and to work well. If you chose a Medigap option, remember it's Medicare controlled rather than insurance controlled. In this regard, Medicare takes the lead, and the insurance company simply follows behind whatever Medicare does. So when I'm with Medigap Supplement, my primary coverage isn't my insurance company at all. My primary healthcare is Medicare. I don't have to worry about who's in network or out of network. There is no network at all. I just have to ask, do you accept Medicare patients? That's it. As long as the provider accepts Medicare patients, then I can use my Medigap supplement for those bills. And what I also know is that anywhere I travel all across the country, there are seniors in all 50 states. And I literally have the largest selection of providers available to me, larger than any other quote-unquote network with an insurance company. It takes all the stress out of choosing a provider. So that was my number one priority. And number two is, I didn't really want an insurance company to have control over what medical services I did and did not need. I didn't want to have to do a pre-notification where they could say, well, at your age, with this circumstance, it's not really something we think you need. I really didn't want to have that as a limitation for the rest of my life. So with the Medigap option, it always defaults to Medicare A and B, because again, they're the ones in the driver's seat, if you will. As long as Medicare A and B takes care of the first 80%, then so will my Medigap. The Medigap isn't going to argue with Medicare A and B. They aren't going to turn something down that Medicare A and B paid for. So it just keeps things simple. The third thing that was really important to me is this. I'm a very fiscally conservative person. I'm the kind of person who likes to pay ahead in rent if I can, pay ahead in utilities. I don't like debt if I can avoid it, because it's just a stress in my life. In my mind, it's one more thing I have to check off until it's paid off. I don't get to check that box unless it's fully paid off, so it just bothers me and stresses me out. So for me, if I were to choose an Advantage plan, I know that at any given moment, anything medically could happen to me, and boom, suddenly I'm going to be faced with thousands of dollars worth of medical debt, or at least the potential to immediately have thousands of dollars worth of medical debt. Whereas if I go with a Medigap Plan G, I could literally choose a program that limits my financial risk to a couple $100. I'll give you an example. I once spoke with a gentleman who almost didn't even book an appointment with me to get this overview because he absolutely loved his current program. And by default, he was just going to put his wife on the same program he had chosen. He said, Sean, I absolutely love my program. I just had open heart surgery, which as we know is probably well over $100,000, and I paid nothing for it. Now, again, I didn't need to know what company he was with because the company or brand has no effect on the quality of service as a supplement. I already knew based on how he described his product that he had a Medigap Plan G because Plan G is the only thing that's going to do that for him. So he had a Medigap Plan G and he finished the surgery and owed nothing. That is a stellar experience. And I just thought to myself, that's exactly why I've always been a fan of the Medigap Plan Gs. Now, I did ask him, I said, how much are you paying for that on a monthly basis? He was in his early 70s, I think around 70, and he said $240 a month. And that was something we took note of, and we'll come back to that even in this overview. But the reality is that was a phenomenal experience that he just had. So that's what someone could look forward to if they chose a Plan G. Of course, there are other perks associated with your Medigap options. For example, you don't have to do pre-notifications. You don't have to go to a primary care doctor so you can get a referral to go see a specialist. And if you're going to go out of country, they give protection up to $50,000 lifetime maximum benefit. So these are other perks with the Medigap healthcare option. Now, it's fair to say that no program is perfect. So there are also cons, or at least things to consider to balance out with all those pros. Number one is that you do still have to get a Medicare Part D drug supplement on your own. This isn't a big deal, but you're going to have to take the initiative to pick one out for yourself and pay separately for that. It's not rolled up underneath one single program like it would be with Advantage plans. But again, not a big deal there. Number two is that it does actually have a monthly cost. So if you're comparing to an Advantage plan, which is often completely free, well, paying anywhere from $100 to $125, at least at the beginning, is a far cry from being free. And the national average starting point for a 65-year-old male in the country for a Plan G Medigap is going to be around $100 to $125. Currently, women get to pay a little bit less than that. Some markets, of course, are higher, some are lower, but those are the national averages. So $100 to $125 versus free. Big difference there. Again, it might be worth it to you. It might be worth it to me. That's why I would be leaning this direction for myself. Okay, third con. I want to bring this up. It's something that seems to be so obvious, and because it's so obvious, it's going to be very easy to completely overlook it. So I want to pose a question. In your experience, do you think that insurance companies increase their cost as you get older? Think about the answer to that question. I'm guessing that in your mind, you probably just answered, yes, of course. That's exactly how I answered that question. And in fact, I probably didn't even fully consider that reality because it's just so obvious that as we get older, our insurance becomes more expensive. If you need evidence of that, just look at what your healthcare may have cost you when you were 23. And I'm guessing it cost you a whole lot more now, right? So the reality is this. When something is so obvious, it's not uncommon for us to become blind to it. I know I did. And this is one of the things that I was completely ignoring in my own mind when I evaluated what I would likely choose when I'm a senior. When we purchase insurance, you know it has a cost that it starts at, and then we can likely expect that cost to go up every single year without end. This is true for everything we choose. So it's important to keep that in mind even with your Medigap options. They start at whatever price point you can get, and frankly, some of these companies, they will offer promotional pricing for year 65. Remember, I said that everyone is trying to look attractive and get your business for the 65-year-old market the most, knowing full well that you're probably never going to switch. There are some circumstances where a company may offer what I call promotional pricing. I gave an example in my notes where a man got a phenomenal rate for year 1 and then moved up to the regular premium fee schedule in year number 2. But then in year number 3, it's going to be higher. And every year, basically, you're on a ramp that goes up and never stops going up. So when you're 70 years old, like the gentleman I mentioned before, he was paying $240 by the time he was 70 years old. If you compare that to where he likely started, that would equal about $120 worth of increase within a 5-year time period. Now, that's not to say that every company would increase the same amount in every market, but what is unavoidable is that no matter where you start, your costs will only get greater and greater. And usually the income for seniors is not going to increase. It's usually going to stay fixed, meaning your Medigap would just take a larger piece of that pie as you got older. It's certainly something to be aware of. Please take a moment now to consider if you have any questions on Medigap or Advantage plans. Write those down, and we'll move on to our next sections. Now we address the final section of your possible options available as a senior in the supplemental space. What else can you use for that fourth corner to take care of the other 20% that's left over by Medicare A and B? And again, just as a refresher, this is the program that I had initially dismissed and would not have chosen for myself based on the limited knowledge I had before my current position. But I believe it is always wise to allow new information to change one's opinion from what I may have previously assumed or thought I understood. Learning more has certainly changed my perspective, and my hope is that you will find this beneficial for yourself as well. As we begin learning about Medi-Share 65 Plus here, this is Christian Care Ministries' version of a Medigap G program. As we previously discussed, Medigaps are standardized healthcare. So any G being offered from any insurance company in the nation is identical to any other one. This means we aren't competing with 100 other programs. We are only competing with one, a standard Medigap G. As such, that means that first and foremost, it is not the Medi-Share complete program. So many Medi-Share members have unfortunately dismissed the Medi-Share 65 Plus program entirely, even if they love their Medi-Share experience, because they just assume it's basically the same program with a different price point. So I want to be very clear here and outline that with the Medi-Share 65 Plus program, it does not use Medi-Share guidelines. It doesn't limit you to Medi-Share's network. It doesn't use Medi-Share's eligibility rules. It doesn't have Medi-Share's billing review process. It doesn't have Medi-Share's health partnership or health incentives, and it doesn't have Medi-Share's price increases. It literally has absolutely nothing to do with the Medi-Share primary healthcare product, except that it is run by the same parent ministry. I think this is an important distinction here. So if you are tying any of your expectations to Medi-Share 65 Plus based on what you have experienced with Medi-Share, just know that they are completely two distinct products for people in two very different places in life. If there are more questions you have about that, I would certainly love to address that with you during our scheduled follow-up appointment. So now that we reset any assumptions or expectations of how our senior program works, let's get into what you need to know about it. With Medi-Share 65 Plus being Christian Care Ministries' version of a Medigap Plan G, what does that mean? Well, it means that it's going to have the same pros list as the Plan Gs we mentioned previously. So let's review those. Number 1, where can I use Medi-Share 65 Plus? Anywhere they accept Medicare patients. As a Medigap, so as long as the provider takes Medicare patients, then you are going to be able to use Medi-Share 65 Plus for that visit. Number 2, what services can I use Medi-Share 65 Plus for? All the same things that Medicare A and B pays for. So as long as Medicare A and B has handled the first 80%, then Medi-Share 65 Plus will take care of the other 20% with one exclusion. And that one single exclusion is non-Christian lifestyle expenses. So just like with our primary healthcare program, you have to be a Christian in order to even be a member. And as a Christian, there's certain ways in which we live our lives. Therefore, medical bills related to non-Christian lifestyles would not be part of that. These are things like sex changes, sexually transmitted diseases, illegal drug use, etc. Obviously, these are not a concern for our members. Now, let's talk about the other perks that come with our program. Like if you ever go out of the country, a normal supplement gives you a $50,000 lifetime benefit, but we triple your lifetime maximum benefit from $50,000 to $150,000. You also get discounts on dental, vision, and hearing through the Carrington Network, just like our Medi-Share Complete members receive. I tend to get a lot of questions about this and have provided a link to their website in my email under Roman numeral 5, pros list number 7. I want you to know what we are saying when we say discount program. A library card will get you unlimited free books and media from a library, but not your local bookstore. Likewise, a discount program like Carrington will help you save anywhere from 20 to 60% at providers who participate in their network. It should not be confused with an insurance product paying for services, though the outcome of saving $1,000 is the same result as someone paying $1,000 worth of bills for you. And then my favorite additional add-on perk is the MD Live telemedicine program. This gives 24/7 access to an on-call doctor who can diagnose a condition and call in medication to your local pharmacy, and you pay absolutely nothing for this subscription or when you use it. Every time you use that service, it could save you anywhere from $100 to $150, so I absolutely love using MD Live. Besides this, you don't have to do pre-notifications, and you don't have to get a referral to go see a specialist. So, with all the same perks as Plan G, why had I initially leaned towards the traditional Medigap Plan G and not the Medi-Share 65 Plus program? The answer really comes down to the truth that we don't know what we don't know. All any of us can do is make the best decision with the information we have at the time and do our very best to get a full perspective, which will equip us to help make the best decision moving forward. Before doing all of this research, when I would consider what I was likely to choose for my future, I was unknowingly looking at an incomplete picture and basing my decision off of that. And here's what I'll say. There were two numbers that I was focused on when it came to Medi-Share 65 Plus. The first number, and imagine we're building a picture here and I'm going to look at only two corners of that picture. I was unaware of the other two corners that I was even missing them. But the first corner that I was looking at was the monthly cost of Medi-Share 65 Plus. Medi-Share 65 Plus is literally a copy of the very best Plan G Medigap supplement that only costs $99 a month. And frankly, that's great. No one complains about the $99 a month for a Plan G program. Anyone would be hard-pressed anywhere in the country to find any company who can get anywhere close to competing with that on a nationwide scale for both men and women, especially on a long-term basis. So I certainly had no problems with that. But the other number that I was considering, the other corner of this picture that I was focused on, was the annual portion with Medi-Share 65 Plus. I'm sure that with Medi-Share Complete, our primary healthcare program, you know you're paying out several thousands of dollars with your annual household portion. And now if you're on Medicare with Medi-Share 65 plus, you have an annual portion of $500. So that's certainly a stunning improvement over the primary care options available to someone before age 65. But that means then let's say I have a $10,000 procedure and then Medicare comes in and says, well, no, you can only charge $4,500 for that. Then I know that my Medi-Share 65 plus is going to be billed for the remaining, say, $900. And since my annual household portion is $500, I'm going to be responsible for that full $500. What I know full well is that I could choose a regular traditional insurance Medigap Plan G supplement that would have only the Part B deductible to pay. So evaluating simply those two numbers, since both are Plan Gs and both are top-of-the-line products for supplemental options, and one has an out-of-pocket of $500 and one has an out-of-pocket of $257, which represents the Part B deductible as of the time of this recording, well, $257 is better than $500, right? And that's basically where I had left my consideration. But here's what I wasn't taking into account. Let's factor in the other two corners of the picture that I was ignoring. Corner number 3 would be the reality that I had completely become blinded to, which is the fact that insurance companies do increase in costs every single year. I mean, go to any large city and one of the largest buildings you'll find will usually be owned by an insurance company. That isn't the result of their charity work, I can tell you. Any of the insurance Medigap options that I would choose out there in the marketplace, regardless of what they were willing to charge me when I start, it has no bearing or reflection whatsoever on what I'm going to be charged the next year and the year after that, or the year after that. So my healthcare is only going to increase for the rest of my life if I choose a traditional Medigap insurance supplement. Then the fourth corner that I hadn't really considered is when Medi-Share 65 Plus was created, they knew full well that it was competing with a product that had a lower out-of-pocket, and they had a $500 out-of-pocket. So how are they expecting anyone to find their product competitive? What they decided to do is find an area that we could complete that no one else could duplicate, and that area has to do with number 10 underneath the pros of Medi-Share 65 Plus in the notes. Medi-Share 65 Plus brings to the market something that no one else in the industry can bring, and that's called a fixed pricing model. Now, what fixed pricing means is that at age 65, you're going to be paying $99 a month along with the $2 banking fee like we talked about earlier. But at age 66, you're going to be paying the same $99 a month. 67, 68, 69, all the way through age 74. So for the first 10 years of being on Medicare, your price will likely not have changed one time. By the time you turn 75 and go to your only price increase of $150 a month, by that point, you would have already had 9 price increases with any other Medigap on the market. Once I factored that in, that was a game changer. Because ultimately, it doesn't really matter whether I'm spending money towards a premium or what we call a monthly share, or if I'm spending it towards a deductible or what we call an annual portion. Money spent is money spent. Remember the gentleman who had a Plan G program, and he loved it so much because he had nothing to pay after his surgery? He just had to pay his monthly premium and got an entire heart surgery paid for. Now, if we consider that he was paying $240 a month, well, you take $240 times 12, and that puts you at $2,880 for the entire year now, plus the over $200 he would have paid for his Part B deductible and subsequent doctor visits. This totals over $3,000 spent in medical that year. What he didn't know is, had he been on Medi-Share 65 Plus, he would have been able to go out of that year paying only $1,712. Where do I get that? $99 and the $2 banking fee times 12 is $1,212. And then you add on the $500 annual portion to reach the $1,712. We would have saved that gentleman over $1,300. And here's the real kicker. The year after that, when he had his annual price increase with his Medigap supplement, he's going to go over $3,000 spent in premiums alone, whether he has any medical bills or not. If he were with Medi-Share 65 Plus, he would be paying nearly $2,000 less than that if he had no medical bills. If he put his wife on our program, that simply doubles his savings. That was really the power of what Medi-Share 65 Plus is bringing to the table. It's giving Christians a fixed pricing model that is set at a much lower plateau. So even at its most expensive, not only would you already know the cost of your program 11 years from now, but you also know that at $150 per month, it will still be less than likely every other Medigap G option in the country for that age. The long-term power of that fixed price savings is really huge. I've heard it explained by an insurance agent that you get the same platinum product without the downside of the price increase, which is really a phenomenal deal. So after evaluating the entire picture and the marketplace options, I wanted all the perks of the Plan G, but realized I could get all of those and even improve on them with the Medi-Share 65 Plus option. Now, ultimately, you have to decide what are your healthcare priorities. The very first decision you have to make when it comes to this fourth corner of your puzzle is, do you want that corner to work like an Advantage plan, or do you want it to work like a Medigap? If you choose Medigap, then your next decision from there is simply, is there any reason I would choose another supplement letter instead of G? If you find that you're an Advantage person or any other letter Medigap, you will need to find that with another company. If you find that Medigap G best suits your goals, you will simply not be able to beat our Medi-Share 65 Plus version of G. This is where I would have you write down any other questions you have on this section, and we will move on to our final chapter of this overview. As I wrap this up, I would like to just once again thank you for taking the time out to pursue more information and to make sure that you've heard the entire story. You can now consider the full picture as you make this very important healthcare decision. My personal decision would have been very different without understanding some of the things that I presented here in my time with you today. We've gone over the foundation of the four-piece healthcare puzzle that we're putting together, the role of Medicare A and B, and the things we need to pay attention to in regards to those. We also have addressed the role of Medicare Part D for our drugs and mentioned the things that are most important to consider there. And most importantly, we've addressed that very fourth corner where everyone is competing for your business. My hope is that this has given you a framework through which you can be fully equipped to decide for yourself which product type will best suit your needs rather than focusing on brand like you may have in the past. I look forward to addressing any questions that you have during our follow-up appointment, and I would say that your final steps are going to be addressed during that call. If you are ready to talk before your scheduled appointment, please call the number and extension on your email. Again, I appreciate your time, and I would pray that God gives you wisdom and discretion as you make choices that may very well be lifelong decisions. And from my family to yours, may God richly bless you.